Welcome everyone. Welcome to ECHO Palliative.
You're not audible, Dr. Jasmine.
Now?
Okay. I can hear you. I can hear you, Dr. Tyson.
I can hear you as well. Yeah.
Let me check. Megan, can you hear me now?
Yes, ma'am. I also hear you.
Thank you.
I think it's from my side. Sorry. I think you're fine.
Yes, clear and loud.
Thank you. Welcome everyone. Welcome once again to ECHO Palliative Care Introductory course. This is batch 5. Before I go to the main session, I request you, if you are not talking, then please unmute yourself. And if you have anything to ask to us, you can raise your hand. I could see Balaram Chandra. If you have any question, we will call you. If not, please, your hand is raised right now. My name is Tasneem Bint Azad. I'm a medical doctor from Bangladesh. I was former program manager for palliative care program in Cox's Bazar, Bangladesh. To let you all know, this was the first palliative care program in humanitarian context in Cox's Bazar, Bangladesh, and all over the world, I guess. Recently, I moved to Lisbon, Portugal, and I'm doing my post-graduation here. And recently, I joined in a leading NGO here as a health and well-being manager in Lisbon project. Before we go to main session, we have our faculties here, and we are really happy to see really good number of participants who are interested. So I will call our faculty's name, and I will request the faculty to introduce yourself. Dr. Megan Doherty, please.
Thank you and good morning. I'm Dr. Megan Doherty. I'm a pediatric palliative care physician from Canada. Previously, though, I did live in Bangladesh. I work in Bangladesh, and I've been to Cox's Bazar several times. I've been to the Rohingya camps. I've done palliative care in the camps very early in the crisis in 2017 and 2018 mainly. And I worked very closely with Dr. Farzana Khan from FKRF, who I think some of you know, who's very involved there. So it's very nice to be back with you, and inshallah, I'll be back in the Rohingya camp some point in the future. And Ami Bangla ektu jani.
Thank you so much, Megan. Fatima Ladha.
Hi, everyone. I'm a clinical pharmacist working in Vancouver, British Columbia in Canada. And I'm actually currently on maternity leave, but otherwise I'm the education coordinator for pharmacists at BC Cancer, and I'm responsible for the education and training of pharmacists. And I also have a clinical practice in general oncology and palliative care.
Thank you, Fatima. Dr. Anna.
Hello, everyone. My name is Anna Work, and I'm a palliative care doctor based out of Canada. And I've had the opportunity to visit Cox's Bazar and worked with Dr. Farzana and Dr. Tasneem. Welcome, everyone.
Thank you. Dr. Hunter, please.
Good morning, everyone. My name is Hunter Groninger. I'm a palliative care doctor in Washington, D.C. in the United States. It is great to be here, and I've had the pleasure of going to Cox's Bazar in the beginning of 2020, right before the pandemic started.
Thank you. Roshan.
Assalamualaikum and good evening to you all. This is Raushanara. By profession, I am a nurse for 20 years, and I am working as a palliative care nurse around 15 years. Yeah, nice to see you. Bye.
Lailatul, please. I think Lailatul is not here. And can you hear me? Will you please introduce yourself to our participants?
Yes. Hi, thank you. I'm Ann Kellerman. I'm a palliative care social worker in Washington, D.C. And this is, I think, my third time teaching in this batch. So it's good to see all of you today.
Thanks, and I can't see all the faculty members. If anyone left, please introduce yourself. We'll be happy to hear from you.
Hello, good evening. Myself, Mr. Susanta. I'm from India, and I work as a palliative staff nurse from last 1 year at India. Thank you.
Welcome, Susanta. I think no one left. Now we are going to the main session. The palliative care course, the introductory palliative care course is designed. We will do one lecturing session, then we will go for the case presentation. But for this introductory one, we don't have any case presentation today. We will go to the lecture. That means the introduction to palliative care, which will be by our Dr. Megan Doherty. And she is the director for pediatric palliative care. She has been working in Southeast Asia for many years now, and she was also in Bangladesh, as she said. Over to you, Dr. Megan.
Thank you, Tasneem. Very nice to be with you, like we said. So I will just give you a very brief introduction to the course, so you know what's expected, so that you can do the course nicely and get the certificate. And any questions that you have, I'm happy to answer. So you've met many of our faculty, and a few of them couldn't join today. So I'm just sharing a nice photograph of all of them so that you can meet them all. A few sent their regrets, but we're really happy to be with you again and to share our knowledge of palliative care and support you as you start to do some palliative care in your setting. So this is a Project ECHO. So Project ECHO means that we have the people at the hub who we have introduced, all of our faculty, and then we are sharing knowledge with all of you. You are in red, you are the participants, and then we hope you'll be able to use some of these ideas to help care for your own patients a little bit better. And I think we should add some arrows to this because it's not one directional. It's not that we give you knowledge or skills or new ideas. There's sharing. So we learn a lot from being here as faculty, from you, from how you practice, how you care for your patients. And I think we all learn from our patients as well. So we bring that experience with us. And there should be some arrows here showing that, you connect with each other. So we expect that, through the course, you will learn from each other. People will share ideas about how they've done some palliative care. We have some participants who are joining the course for the second or third time because it's a supportive place where you can get support to do palliative care for your patients. So we all learn together in the course. And many courses in the past, and Two Worlds is the main organization that I work with. We've done 4 previous courses. This is the 5th batch, and we do some other ECHO courses that I've listed there. We have a postgraduate ECHO for it's much more advanced level for pediatrics. We've done introductory basic pediatric palliative care and COVID echoes, etc. So there are other courses once you finish this one that you'd be eligible for, more things you might be interested to learn from our ECHO programs. And also I would encourage you to look at the ECHO programs from Pallium India, who does a lot of ECHO teaching on palliative care in future. And again, these are certificate courses, so they can be very useful for your future work. So we'll share many of those links in the WhatsApp group as we go. Our main organizations, just so you know who is running the course, is Fasiduddin Khan Research Foundation, which is a Bangladeshi-based organization that is working to provide palliative care for Rohingya refugees. So you may see FKRF logo on some things because they're very involved. And PalChase. So PalChase is a network of healthcare professionals, and others who are focused on advocating for the palliative care and end-of-life care needs of people affected by humanitarian disasters, mass casualties, and humanitarian events. And that includes people living in refugee camps, like our patients, many of whom are Rohingya refugees, come from Myanmar. So that would be considered a humanitarian crisis. And in crisis situations, we don't just think about the people who are living in the refugee camp. Of course, as you all know, the host population is also very important because there's a lot of burden on them as well. So our response is focused on both the host population in the Cox's Bazar region and the Rohingya refugees who are here. And so I want to emphasize the most important thing from ECHO and from this learning program is that we all teach and we all learn together. So we create a supportive community of practice where we all learn together, we share lessons, we ask questions, and we discuss. And so the discussion part is very important. If you just come and you listen and you sit there, you won't learn so much. You really have to think about it, ask questions, think about how it's going to come to your own practice, and that's what's going to really help you learn more. So in total, there will be 11 sessions. There are 7 sessions that are mandatory and 4 that are considered CME. Okay, so these are optional, and we invite everyone who's previously attended the course to join these sessions because we rotate the topics, and there's many different topics that come in the CME sessions. So each week, starting from this week, there is going to be a video to watch before you join the course. The videos are very short, they're maximum 20-minute videos, and most of them are available in English and also in Bangla. So we have usually 2 videos, an English version and a Bangla one. If you prefer English, you can watch English. If you prefer Bangla, you can watch in Bangla. They're identical videos, and we ask you to prepare by doing the video. Then you come to the class, we give a summary of the video, and we watch, and then we talk about a case, a clinical case that one of our faculty presents. So if you join all the 7 mandatory sessions, then you will get the certificate at the end of the course. And the main person who's organizing the certificates and doing all of the program administration is named Josh. And this is the email address that you can reach him at, palcarerrc@gmail.com. So please send him an email if you're having any logistical problems. For each session, this is how it will go. Sorry, it starts at 8:30, not 7:30. Previously started at 7:30, but so we have a summary of the topic for 15 minutes from one expert. Then we have some discussion about that where you can ask questions. Then we have a case presentation from another faculty member. And then we have case discussion and questions. Okay, and you can see there's a lot of time for discussion because this is where the main learning happens. Then we give a summary in Bangla, and we also have announcements. And we always have Bangla speaking faculty on the call. So if you want to ask a question in Bangla, you're most welcome to ask it if that feels better. If you want to type a question in the chat, you can do that. You can write a question in the chat in English or in Bangla. Here is a list of topics that we will cover. And here's the schedule for the course, which we'll share on the WhatsApp group immediately after today. So we have sessions that are in green, which are mandatory, and sessions which are in blue, which are CME. I'm sorry, one is in yellow here. That's a mistake. It's supposed to be blue as well. Or sorry, it's supposed to be green as well. So remember to keep your video on if you can, just so we can see you. It helps us interact better. You keep yourself on mute, please, to avoid any background noise. And then just like I said, label yourself so we know who it is who's here. Because we can't take attendance. And if your name is Samsung Galaxy, we don't know that it's you, okay? And we have a Google Drive, which we will share, and all the resources for the course are in this Google Drive. So every week we share the PowerPoint slides, we share some articles, anything else that we discuss will be available here. And then we also have a playlist on YouTube, and that is where you can watch all the videos, but every week we share the link for the video by WhatsApp and by email. So like I said, everything is in the WhatsApp group for the course. And so it's really good to keep an eye on the WhatsApp group because Every week we'll share everything there. We also share everything by email, but I know a lot of people prefer the WhatsApp. So that's a summary just of what to expect from the course. And I'll hand back over to Tasneem.
Thank you, Megan. Exactly on time. As Megan said, we will all learn from here, and we will teach also here. That's how it is. So we want it to be very interactive. If you have any question related to this, you can write here, you can unmute yourself, or you can reach to our WhatsApp group also if any question arises later. Now I will go to our next speaker, who is Dr. Hunter Groninger. He is the Director of Section of Palliative Care, MedStar Washington Hospital Center. Over to you, Hunter.
Thank you, Dr. Tasneem. I am going to share my slides. Let me know if this works. Is that working?
Yes. Yes.
Great. And you can hear me okay?
Perfect.
Super. Okay. I'm going to spend, good morning, everyone, or good evening to those of you in Bangladesh. I'm going to spend a few minutes to provide an overview about palliative care and to tell a couple of clinical stories to give a sense about how interdisciplinary palliative care can positively impact patients who have a serious illness and positively impact their families and their caregivers. I will also touch on a little bit on the need for palliative care services all over the world, but particularly in Bangladesh and in relation to humanitarian crises. So let me start with telling you a story about a young boy named Mojibur. In this story, he is 10 years old and he was diagnosed with an osteosarcoma. Before he became sick, he was a typical boy. He loved playing with his friends, running around, playing football. And now he lives in the refugee camp with his mother and with his two little sisters. His father went missing after the family was forced to flee Rakhine State in Myanmar. So when the palliative care team came to visit him for the first time in the camps, he was lying in his tent. He was unable to move because of pain. He had just been diagnosed at a local hospital with the osteosarcoma. And his mother shared with the team that when he was diagnosed, he and the family spent all night crying, fearing that he would die. So what the team was able to do was really think about the pain that was being caused by the disease and begin to provide pain relief to the boy and provide support to the family. And after 2 months later, you can see the different photograph on the right. He is walking around. He's able to play football again with his friends, smiling a little bit and feeling better. So this is an example of how in the setting of a really serious illness, like an osteosarcoma, that palliative care was able to improve the quality of his life and improve the quality of life for the family as well. And by the end of this particular story, the mother would talk about how her son was free of suffering. He was able to be himself and enjoy life to the extent that they are able to, and was very grateful for that kind of help. So you can see the difference there. I won't take too much time with the whole video. So palliative care, what is this? This is an essential area of healthcare, really focusing on relieving and preventing suffering of patients who have an incurable disease. Some of that is related to pain assessment, assessing other symptoms that are related to the disease. And a lot of what we do is related to communication with patients and families, a very active listening and a therapeutic presence. And during the course of this course, you will learn about all of these different topics. Why is this important in a humanitarian crisis? Well, as I think we all know here, in a humanitarian crisis, there are many situations in which a curative care, making the disease go away, is not the primary mode of care that is possible in a humanitarian crisis. Here are some examples that might resonate with you as care providers. Consider a frail, older person who's been forced to flee to a refugee camp in the middle of a civil war. Consider a child with Ebola virus disease admitted to a treatment center with a very high likelihood of dying from the Ebola virus. Consider a baby born prematurely in an earthquake situation, not able to receive needed intensive care because other babies have a better chance of survival, and there are not enough resources for all the babies. All of these cases, all of these people really need and deserve compassionate care to control their symptoms, to alleviate their suffering, and also consider how their suffering relates to psychosocial needs and spiritual needs for them and their family. Just a couple of facts to share with you about palliative care around the world. Every year, about 40 million people seem to be in need of palliative care, and most of them live in low or middle income countries. On the other hand, in spite of all of this need, only a fraction of those people, maybe around 14%, actually receive this kind of care. So there is an ongoing global need for more palliative care awareness and for more palliative care delivery. And part of being a part of that solution is being here today, learning about palliative care so you can develop these skills and bring them to the places where you work right now. And I will narrow in on Bangladesh for a moment. Each year, an estimated 600,000 patients in Bangladesh need palliative care. Among those, 200,000 patients are diagnosed with cancer every year. And in Bangladesh, almost all of those cancer patients are deemed incurable at the time of diagnosis. So there's so much work that we need to be aware of and be engaged to do to serve the people around us. And some examples about the patients who receive palliative care from some of the local teams in Bangladesh, in Cox's Bazar. The total number of patients served, almost 6,000 over the course of 9 months, including 1,000 patients from the host community. So Dr. Megan was talking about the importance of not just serving the individuals in the camps, the refugees, but also serving the host communities around those regions as well. I will touch for a moment on the Sphere project and just give a sense about the humanitarian health sector as a whole and policies around it to emphasize the importance of the learning that you are having today and the work that you will be doing as you develop palliative care skills. The Sphere project really seeks to define a minimum standard for humanitarian workers through specific guidelines. And you can see some examples on this slide of standards for managing communicable diseases, for child health, for mental health, but it is only since 2018, only about 4 years ago, that palliative care has been included in these guidelines. So this is a very important recent engagement of humanitarian workers and policymakers to be aware of palliative care and begin to include that in the kind of work that has to happen in humanitarian settings. So let's talk for a moment about what are some of the challenges to delivering palliative care in humanitarian settings. This is a complex figure, but you can imagine as you spend a moment looking at different aspects of this figure, some of the important pathways to delivering palliative care, and therefore some of the challenges that we need to try to address when we deliver palliative care. For example, in order to provide best pain management for patients with advanced illness, we need to be able to have the skills to assess and prescribe pain medication. And we also have to be able to have the pain medication present. And something that I think will come up in many of the case discussions during this course is about what opioid therapies or other pain medicines are available in your location, which ones are not, and how do we manage those challenges when there is not the best or not enough pain medication to treat the patients that we need to treat. Cultural specificity is also important, and we will spend a lot of time in this course talking about how palliative care delivery really needs to be aware of the local cultures of our communities that we are serving. Consider my statement earlier about the importance of assessing psychosocial dynamics in a family, or assessing spiritual needs of a patient. And we have to be aware of local cultures so that we can provide the best, most supportive care to those patients in their communities possible. People often ask, how is it possible to ensure palliative care in a humanitarian crisis if we don't have enough curative care to manage the diseases alone, to try to change the trajectory of the cancer or the heart disease? Isn't palliative care a luxury? But I think we really want to reinforce here that we believe that these are not two different issues. You either are trying to cure a disease or you cannot cure a disease. Palliative care, we will reinforce this through the course, is a mode of care that is provided in the time of need throughout the course of the illness. And I think that when you explore the lessons that we'll share with you and explore and engage in the case discussions that we'll have, hopefully you will also begin to see that palliative care, providing best supportive care, is something that can and should happen throughout the entire course of the disease. So just to narrow in a little bit more on how much work we all have to do together in Bangladesh. This is a complex slide, and I won't spend too much time on it, but just to give a sense that in the context of the world, all of the palliative needs that are apparent around the world, and Bangladesh in particular has extraordinary need for more palliative care services. So you will be a big part of this solution in Bangladesh and in Cox's Bazar specifically. And that involves being part of a solution as human resources, people who can provide the care, in providing high quality care. And that is something that we hope to reinforce through the skills that you will develop through this teaching, engaging with the local communities, helping them understand what palliative care is and how you can be of service to those patients. Think about our initial case of the 10-year-old boy and how important it was to be able to help his mother understand that we are here to help him feel better and therefore have a better quality of life and be more functional in spite of having this terrible osteosarcoma. So to conclude, again, I will reinforce that many people think about palliative care as a service that only is supposed to happen when people are at the very end of their lives. But this is not true. Palliative care can and should be provided for months or even years throughout the entire illness experience. We know from clinical studies that good palliative care does not hasten death. It does improve the quality of life for patients who are facing a serious illness or a life-threatening illness. It also improves the quality of life for their families who have not only the love for the patients themselves, but the burden and the work of doing so much caregiving for our patients. Palliative care is person-centered care. So in this final case, consider this 51-year-old woman who was diagnosed with an inoperable small cell lung cancer. She's offered and she accepts palliative chemotherapy, hoping that the chemotherapy will improve her breathlessness, but she develops severe vomiting and other side effects from the chemotherapy and needs to be admitted to the hospital. And later on, she ends up noting that she regrets the chemotherapy. If she had known that the quality of life would be so poor while getting chemotherapy, she might not have chosen that. She might have chosen instead to be more comfortable at home around her family. And ultimately, this is what palliative care was able to provide her, to be more comfortable and to be at home with her family, where she stayed until the end of her life. So in summary, palliative care, it is holistic care. It is for all patients who have a life-threatening or a life-limiting illness, for all age groups. And that includes, as we've mentioned before, newborns all the way to very old individuals. And it's really focused on improving comfort and function in spite of the disease state that the patient is experiencing. So I will stop there. Thank you very much for your attention, and I will turn it back over to Dr. Tasneem.
Thank you, Dr. Hunter. It was very informative and insightful one. We will go to our next part, that is, we will open breakout rooms and we will hear from you why you are doing this course, what palliative care means to you.
Okay, so so you just have to click accept and then go into the room and introduce yourselves. So in the room, you can say your name and why you're joining the course, and there's one faculty in each group. Okay, I think we should have everybody back in the main room now, Tasneem. The breakout rooms are closed completely.
Great. Thank you, Megan. Yes, it was a good experience. I will share my one because I got 12 participants, one from West Africa, Ghana, all other from Bangladesh. Looks like most of them are working with in the Rohingya camp. And it was good to know that why they are here. Many said that they want to mitigate their learning gap and they want to hear more from us. Some of them say that a few participants from our previous groups joined to this one, and they said really good things. That's why they joined to this one. And many of them were saying very practical situation that they were facing in that low resource settings, and they wanted to know how they could learn more about palliative care from this. So from my side, this was the comment, I would say, and let's go to the next group, how it went.
I think I was in group 2. I'm
What
happy to
group
share.
number?
Yeah, I think I was group 2, and we had, I think, 11 or 12 participants. Thank you all in my group for sharing. People mostly are from Bangladesh and from Cox's Bazar and the camps. Some folks were in different areas. One individual from Sri Lanka. So I think everyone had common interests to learn more about palliative care, to do some of the things that we've been talking about today, alleviating suffering of patients that are right there in front of us. Good conversation.
Anyone else wants to share their experience? How was it, this breakout session?
I think my group was also very active. I heard from about 10 or 12 people in my group, so I really want to welcome all of them, many from MSF, one from India, one from Sri Lanka as well, and some people joining for the second or third time. So huge welcome. And those who are experienced now, I'll mention specifically Dr. Mohammed Pias, who's been with us for quite a while and is getting much more experienced. Then please mentor your colleagues who are just coming for the first time, be a buddy and a mentor to them and support them. And I apologize, I think one of the rooms did not have a facilitator because the facilitator got disconnected. So if you didn't have a good experience, I apologize. We'll keep working on it. There's a lot of participants today, so it's a little bit more challenging there. And somebody is messaging at the WhatsApp group. They can't join because it's saying it's full. So again, we will try and fix that in the next day or two. But if you've registered, I want to emphasize this. If you register with the link, and we have 207 people who have registered, if you have registered and given your email ID, you will get an email each week, usually on Thursday, with the information. So if you're not in the WhatsApp group, you won't miss it, but we will try and fix the WhatsApp group if you can't join it right now. I apologize.
Looks like we're at the end, Megan. Should I go for the Bangla summary now?
Sounds good.
Megan, I couldn't hear you. Did you say anything?
Yeah, I think you could go ahead with the summary.
Okay, thank you so much. আসসালামু আলাইকুম, আমি বাংলা সামারি করছি আজকের যেই আমাদের ক্লাস ছিল সেই সংক্রান্ত। যারা বাংলা ভাষাভাষী আছেন আশা করি তাদের জন্য এটি খুবই সহায়ক হবে। প্রথমত আমাদের আজকের এটি ওয়েলকাম সেশন ছিল আপনাদেরকে জানানোর জন্য যে আমরা কিভাবে এই কোর্সটি পরিচালনা করব। আমাদের মোট 7টি কোর্স থাকবে, 7টি ক্লাস থাকবে, যেগুলো হচ্ছে ম্যান্ডেটরি, যেটা আপনাকে করতেই হবে সার্টিফিকেটটি পাওয়ার জন্য। এটা ছাড়াও এই কোর্স কমপ্লিট হওয়ার পর আপনি অন্যান্য বেশ কিছু কোর্সে এনরোল করতে পারবেন প্যালিয়েটিভ কেয়ার সংক্রান্ত, যেগুলো আমরা ধাপে ধাপে আমাদের হোয়াটসঅ্যাপ গ্রুপে আপনাদেরকে জানিয়ে দিব। আমাদের ক্লাসগুলো হবে প্রতি শুক্রবার রাত 8:30 থেকে 9টা 9:45 পর্যন্ত, এটা অবস্থা ভেদে। আমাদের প্রত্যেকটি ক্লাসে আমাদের লেকচার থাকবে একটি নির্দিষ্ট টপিকের উপরে এবং থাকবে একটি কেস প্রেজেন্টেশন, যাতে আপনারা বুঝতে পারেন প্র্যাকটিক্যালি কাজগুলো কিভাবে হচ্ছে বা আমরা কি ধরনের সমস্যার মুখোমুখি হয়ে থাকি। পরবর্তীতে আমরা জানতে পেরেছি ডক্টর হান্টারের কাছ থেকে, যেটাতে আমাদেরকে বৈশ্বিক যে অবস্থা, প্যালিয়েটিভ কেয়ারের প্রয়োজনীয়তা কেন রয়েছে সেই সংক্রান্ত কিছু বিষয় বলা হয়েছে। আমি শুধুমাত্র বাংলাদেশের বিষয়টিতে আসব। বাংলাদেশে প্রতি বছর 6 লক্ষ লোকে প্যালিয়েটিভ কেয়ার সেবার প্রয়োজন হয়, যার ভেতরে 2 লক্ষ মানুষ হচ্ছে ক্যান্সারে আক্রান্ত। এর চাইতেও ভয়াবহ হচ্ছে 80 থেকে 90% ক্যান্সার আক্রান্ত রোগী যে অবস্থায় ডাক্তারের কাছে আসেন বাংলাদেশে, তখন সেটি আর নিরাময়যোগ্য অবস্থায় থাকে না। এটি একটি নোট রাখার মতন বিষয় যে কেন আমাদের প্যালিয়েটিভ কেয়ারের প্রয়োজনীয়তা রয়েছে। এছাড়াও পেশেন্ট সেন্টার্ড কেয়ার বলে একটা বিষয় বলা হয়েছে, সেটা হচ্ছে অনেক সময় রোগীকে তার জীবনের শেষ অবস্থায় বলা হয় না তিনি কি ধরনের সেবা চাচ্ছেন বা যে সেবাটি তিনি নিচ্ছেন সেটি থেকে কি কি খারাপ দিক থাকতে পারে, অথবা বেছে নেওয়ার সুযোগটি থাকে না। এক্ষেত্রে কেমোথেরাপির কথা বলা হয়েছে। অনেক রোগী কেমোথেরাপির ধকল সহ্য করতে না পেরে প্রায়শই মন্তব্য করেন যে আগে জানলে প্যালিয়েটিভ কেয়ার নিতাম না, কেমোথেরাপি নিতাম না, এই ব্যাপারটি আসে। এই জায়গাগুলোতে আমাদের কাজ করার বিষয় রয়েছে। এছাড়াও আমরা ধারণা দেওয়ার চেষ্টা করেছি আপনারা হোয়াটসঅ্যাপ গ্রুপ থেকে কিভাবে আমাদের রিসোর্স গুলো, আমাদের আজকে যে ক্লাস হচ্ছে অথবা ইউটিউব ভিডিও লিঙ্ক গুলো আপনারা কিভাবে পাবেন। আপনাদের যদি কোনো জানতে চাওয়ার থাকে আপনাদের নিজেদের অ্যাটেন্ডেন্সের ব্যাপারে অথবা কিভাবে এনরোল করবেন সেই সংক্রান্ত, আমরা একটি ইমেল অ্যাড্রেস শেয়ার করব, সেটি থেকে আপনারা জানাতে পারবেন যে আপনি আজকে জয়েন করতে পারেননি বা আপনি জয়েন করেছেন কিন্তু আপনার অ্যাটেন্ডেন্স দেওয়া হয়নি, এই সংক্রান্ত বিষয়গুলো। এবং আপনারা যদি সরাসরি চান আমাদেরকে লিখতে পারবেন হোয়াটসঅ্যাপ গ্রুপে। আর সব শেষে ডক্টর মেঘান বলেছেন আমরা সবাই শিখবো, সবাই শেখাবো। এই ব্যাপারটাতে যদি আমরা লক্ষ্য করি তাহলে কথা বলাটা জরুরি। ধন্যবাদ সবাইকে। থ্যাংক ইউ মেঘান।
Thank you. I just made a new WhatsApp group because we had been using the same group for each course and we have too many people now. So apologies, we'll switch and have a brand new group just for this course. Okay, so if you join the old group, click the link in the old group and join the new group, because the new group has enough space for everyone. Otherwise we are out of space. Thanks. Have a good session. Have a good week. Balo taken, aberdeka hobe.
Thanks everyone.
Thank you so much for your kind information.
This is the end of the session today.
It is. We ended with that Bangla summary that will be same for every session because we have so many Bangla participants here. Those who were writing about Bangla summary, it will be in Bangla because we have so many participants from Bangladesh, but still we will try to sum up with something English also to let you know in case you missed the very first half or something like this. We will try to connect. Thank you. Aparna, do you have any question? I could see your hand raised.
Yes, just one question. This WhatsApp group, is it with a mobile number? Because if so, then I haven't received the group meet on WhatsApp. I just needed to know if it is a mobile or a separate app. I live in India.
It's an app. It's an app for your phone. You have to download the app.
Okay,
and then
right.
once you have the app, if you click this link, you can join.
Right.
But we duplicate everything. Like everything goes by email and also in the WhatsApp. So you won't miss it if you don't have the WhatsApp.
All right.
But sometimes people like it better. So.
I like. Thank you. Thank you so much, Megan.
No problem. Thank you.
Bye.
Thank you, Tasneem, especially for the excellent Bangla summary.
How could you know it was
Shabai
excellent?
Sheikh, Shabai Lek. How do you say?
সবাই শিখবো, সবাই শেখাবো।
সবাই শিখবো, সবাই
শেখাবো।
সবাই শিখবো, সবাইকে শেখাবো।
I'm learning. I'll be back in Bangladesh in the next few months, so then I'll practice more.
Ah, that's good. That's great to hear, Megan.
Okay, good night from Bangladesh.
Ciao.